So welcome to the Mills and Reeve second breakfast briefing session. And this is presented by our food and agri sector, and we liaise with different specialist departments across Mills and Reeve. And Mills and Reeve is a national full service law firm. For all your legal needs. And this morning we're going to be discussing this really interesting aspect of the food sector with Katrina Anderson and Rhian Vandrill. But we're leaving just a minute or so for those who are joining with their coffees before we get started here. But just like to welcome everyone and introduce you to the Mills and Reeve breakfast briefing sessions. So we've got half an hour, and it's just going to be a conversation where we're going to look at the main aspects and the difficult questions around this, and look ahead as well to what might be happening in the future. There will be a feedback form at the end, and be really, really grateful if you would spend just another few seconds to fill that in when we have finished. And this session will be recorded so that there will be details circulated afterwards, and we will try to get to Q&A at the end. If there's any ongoing questions or points, then please do get in touch with us directly. So without further ado, I'd like to introduce you to the main contributors here. This is Katrina Anderson, who is a senior associate in our food regulatory and commercial practice. And Katrina looks at all aspects of food regulation, food labelling, consumer protection, and is at the cutting edge of brand protection. What is the HFSS foods, and what the restrictions or requirements will be around this. Rhian Vandrill, she leads our commercial health practice, working with both public and private sector clients in the commissioning and delivering of NHS services. She is at the forefront of NHS organisational change and is involved in the impact of the government's 10-year health plan. So exactly the right person to sort of look ahead and see where the government's main priorities are going to be in relation to this. So looking at the fascinating subject of foods that are high in fat, salt and sugar, I'll provide a very brief synopsis of what has been going on. We started out with the nutrient profile model, which unbelievably was in 2004, 2005. So we're at 20 years that we've been dealing with the same nutrient profile model, with the scoring system, positive and negative nutrients, judging individual foods as to whether they are HFSS. This was designed for the advertising side, where you're not meant to direct HFSS food towards children, and you're not meant to have more than 25% of your audience made up of children in the media it's directed at. This was then followed by the soft drinks industry levy 2018, and the thresholds for this, that was stationary just until last autumn's budget, where it's been revisited. So we are seeing some of these aspects looked at again. We're almost coming a full circle around. Then the calorie labelling on menus, that came in 2022. For certain foods, 30 days, certain size of restaurants, you have to then put the calorie labelling on the menus, and the location, the placement of certain HFSS foods in retailers. This is where you can't put your chocolate bars by the tills. Then we've had a bit of a gap, and now 2025, we have the volume restriction coming in to match with the placement restriction in retailers. The bog-off deal, was it going to happen? Was it not? It's in place 1st of October. And finally, but not least, there is the advertising restriction, which is now coming into place the 6th of January next year, was going to be the 1st of October. So bit of a rattle stop tour there. Katrina, where are we? What's going on?
Well, I mean, you would be forgiven for being a little bit confused because we have had an extremely topsy-turvy year, even by the standards of HFSS, which I think is an agenda that has sort of historically stop-started and had a lot of sort of complexities to it. But across this year, we've seen delays, we've seen statements in Parliament, we've seen three versions of the draft guidance, which have been hotly contested. We've now got a new statutory instrument. But I think we have got ourselves to a place where I suppose there is a reasonable amount of certainty for the foreseeable. And the big thing that we are going to be expecting that will change the dial for us will, of course, be the enforcement. So, as you alluded to, we've got two big things going on at the moment. The first is the marketing restrictions. Those are coming in England, in fact, sorry, have come in already in England and Wales just a week or so ago. There was a little bit of uncertainty because we obviously had some mixed messages about whether this was going to be replaced by smarter regulation. And I know Rhian will be talking about the context for that in the NHS 10-year plan in a minute. But at least for right now, those restrictions on volume promotion, so that's things which are offering additional volume for free, like bog-offs, have come in England and Wales, and we have been promised equivalent legislation in Scotland in due course. No news at the moment on Northern Ireland. And then in terms of the advertising restrictions, that, as you say, as a legal restriction is now delayed to the beginning of next year. But we have this so-called voluntary ban that has come in anticipation, and that is UK-wide. And we'll be talking a bit more about some of the complexities on that. I think we have landed on some fairly final guidance. It's in consultation at the moment, but we're not expecting it to change.
Why was there this delay? What was the cause of this?
What
It
was the
was meant
cause
to
of the
come
delay?
in
Yeah,
October, the
it was meant to
restriction
come
on
in.
HFSS advertising over all online, and the
Hmm.
threshold, the 9 p.m. threshold on our TVs, a massive change for
Yeah.
certainly the online advertising. And it was meant to come in October. It's been delayed. Why?
Yeah. Why has it been delayed? Well, first of all, this isn't the first delay. It's been delayed a couple of times already. This particular delay was all around the controversy around the so-called brand exemption, and this is about adverts which are not for a specific product, so they're not for a product which can be profiled using the nutrient profiling model and can be assessed against the categories, but it's about a brand which has a, if you like, a, look sits above an entire range or even multiple ranges. And the question was, how should such advertising be treated under the legislation? And the initial guidance suggested that such adverts, because they did not have an identifiable product, they should be out of the scope. That was hotly contested, it is fair to say. So we had a second set of guidance, which kind of took the opposite approach. And then, of course, Parliament got involved, and we now have a new piece of legislation which officially creates this brand exemption and says efficiently within these parameters, an advert which is not for a specific product and where there's not an identifiable product and it meets certain criteria around brand exemption, that sits outside of the rules. And that's where we've landed. But I suppose the passage of time needed to, I suppose, have these consultations, have the debate in Parliament, pass the exemption, meant that the consequence of this was that it got pushed back, at least legally, until the beginning of next year. But part of the deal was the voluntary ban, that
In
industry would
relation
respect
to
it.
in relation to an identifiable
Hmm.
product, what if your brand is only associated with HFSS foods, and yet you do not actually reference those, you just reference your brand?
I mean, the brand exemption is within certain parameters supposed to say that if you are not, even if you have a brand which sits above perhaps a category which is quintessentially HFSS, like chocolate, for example, you are still supposed to be able to advertise your brand. And the logic of this is, first of all, the policy objective of all of this has always been reformulation because it comes back to the health point. The idea is that by putting these restrictions in place, not only are you reducing demand by reducing consumer interest, but you're also incentivizing manufacturers to reformulate. And the government does not want to pigeonhole brands which are historically associated with HFSS, but actually have made, and some of them have, enormous strides to make sure that their products have been reformulated so that they're outside of the restrictions.
I do realise I was slightly unfair when I asked that question because there's been limited guidance, and we are all of us looking ahead, even this spat between the ASA and the government, that this is why it's been sort of a little bit made up as they go along. The other questions that I'd like to ask you, Katrina, would be around the categories and the thresholds. And I know this is again a hotly contested issue as to whether a product is going to be sort of with the instructions on how to eat, how they actually would review the foodstuffs and what happens if you're on a threshold.
Absolutely. And I think this is, of course, perhaps the effect of that policy objective to try and encourage reformulation. Inevitably, you have products which sit on the edges, if you like, of the definition, either of the HFSS model itself or of the categories, because of course this new generation of HFSS legislation has the two-tier test. And it does mean that if you are kind of borderline or your product is borderline, there are potential things that you might be able to do to push your product either in or out. And it can sometimes have to do with how your product is presented, particularly if you're thinking about the categories, what you present it for use for might put you in or out of a category, but also, at least in part, the HFSS model is influenced by the instructions for those products which need to be made up. So you don't eat them literally as they're sold. And sometimes tweaking the instructions can have the effect of taking a product in or out of scope. So there's a lot of people who are looking at those grey areas and those little edge bits to try and work out if there is a way to, I suppose, take a product as it is existed, formulated, but kind of reposition it a little bit so that it is outside of the scope of the
Yes.
restrictions.
I think this is because it's going to be marketing, advertising. You're dealing with a lot of creative people here.
Yes, you are.
You're dealing with the sort of a relatively nebulous food category, applying the strict nutrient profile model and then trying to shoehorn things in. Where do you see the ability to advertise outside of these restrictions on this of online blanket online ban and the threshold TV ban? Where do you see perhaps adverts going for
Mm.
HFSS foods?
Well, I actually wonder before we dive into that whether we should have Rhian talk about the
Okay.
direction of travel and the health plan, because actually, as you have alluded to, this is quite a narrow ban at this
Mm.
stage. It's on broadcast TV, watershed, and it's on paid for online, which means there is still there's a lot of outdoor advertising, there's a lot of organic online, there's a lot of direct marketing you can do. But I think hearing a bit from Rhian about the direction of travel would help us kind of predict perhaps a little
Yes,
bit where we're going.
and Rhian, this brings in the policy direction, the Fit for the Future 10-year plan. We've had Boris's obesity strategy. We've had Dimbleby's UK's England strategy. We've had the House of Lords sort of fix our broken food system strategy, and now we've got the Fit for the Future 10-year strategy. Were your views with the overland overseer side of things?
It's interesting. You described your area of food regulation as quite topsy-turvy, and I've always described working in the NHS as being on something of a roller coaster because it's both a vote winner and something that is often very dear to the British public, as well as being a political football. And what governments like to do is every 5 to 8-ish years rip everything up and start again. And gosh, I mean, I've been working in health for over 20 years now, and you see so many changes whether it's structural changes or, back in about 2015 through to 2020, we were talking about the 5-year forward view and our vanguards, and now suddenly new government and it's a new 10-year plan. So, it's a bit of here we go again. That's not to say that there isn't a lot of really good ideas in the 10-year plan. I hasten to not use the word substance, because the caveat I give you today about the 10-year plan is that it is light on detail. It is aspirational. It's full of what you might call the Daily Mail headline grabbers. And it reads quite well. I mean, it runs to something like 200 pages, published in July, a few months later than it was meant to be. Again, it gets caught up in the political machinations. But what it is basically saying is this is a new start. Our NHS is not necessarily fit for current purpose, and certainly not fit for the future. So this 10-year high-level generic plan, implementation plan with all the detail, and more importantly, how this is going to be financed to follow. That'll be the really interesting part. So if you'll have me back, I'll come and talk then. But it has 3 key, what they call core transformations, one of which is particularly relevant to the conversation we're having this morning. So the first core transformation is what they call from hospital to community. So the neighbourhood health service. It's difficult to argue with the logic of that, but that is something that has been on the NHS agenda for many years. So treating somebody in a hospital is the most expensive way to deliver NHS services. And actually, people do want to be treated at home. They want to stay at home. They want access to local services, our, in certain times, our so-called beloved primary care services. So that's very much the first core element. The second one, given the age that we're in, where just about everybody's got a wearable that tells them they're not doing enough steps, and that they're probably too stressed and not sleeping enough, is that analog to digital move. And again, really difficult to argue with that. Gosh, I remember when my children were born, the red books that you have to carry around with you as they track their growth. And nobody really wants to be dealing in hard copy medical notes. We're all used to running our lives on our phones. So being able to have electronic patient health records that can be accessed wherever you are in the country or indeed abroad, much better than having to phone up your local GP and they go and find that. Do you remember those little brown pockets where all your medical records were sitting? Those days are gone and going. But the one that's most relevant for this morning is the treatment to prevention core transformation. And that has a number of different angles to it, but with a particular focus on the obesity challenge. The whole of the NHS plan is full of statistics, but I did want to just draw people's attention to a couple, if that's okay. So apparently in the last 30 years, obesity rates have doubled. Now one of the leading causes of cancer, type 2 diabetes and cardiovascular disease. That inevitably puts a significant strain on the NHS in various different forms. Again, the plan says that the last comprehensive estimate of the economic cost of obesity in the UK back in 2020 was about 98 billion to society, nearly 20 billion of which falls on the NHS. I mean, that's clearly not sustainable from an NHS service perspective. So we've got a number of proposals, high-level proposals. Please do remember that caveat of things that we should expect to be coming up the tracks. So restoring the so-called Healthy Start scheme, which is due to come into place 26-27 to support poorer families. Introducing, you'll talk a bit more about this anyway, but introducing the mandatory health food sales reporting for larger companies, expanding access to weight loss medication. Wes Streeting has talked, I think it may have been in Liverpool at the party conference last week, about the inequality of access to weight loss medications basically being a return to the days where health was determined by wealth. And, as we all know, the NHS is still designed to be free at the point of need. We've also got some talk about using NHS digital weight management programs, working with the Department of Culture, Media and Sport to improve exercise take up in the country, and generally introducing incentive schemes, which we've seen in other parts of the world, to encourage people to take positive actions to improve their health. So, and then there's some very specific ones
It seems to be
around childhood.
It seems to be looking quite a lot towards the prevention side
Yes.
of things, as well as looking at the looking at the causes of it. I do see that there has been a much more of a push towards prevention around the obesity side of things. And it's interesting what you mentioned about the data side. Katrina, in relation to the data, we've seen some interesting proposals coming through or in relation to the food sector on this.
Yeah, absolutely. And I think it is becoming clear as a result of the NHS 10-year plan, but also other statements that we've had from Wed Streeting and other sources, that we are going to be moving at some point to a system where the food and agri sector is going to be doing more reporting on data, probably mainly retailers, but potentially also out of home. And that may replace some of the restrictions that have come into force. So there is definitely a talk about using not just reporting that data, but actually setting targets and potentially either incentives or perhaps disincentives
The
to
actual
meet the various.
penalty.
Yes,
It's
potentially a penalty for not meeting those. And I think the concept is that, and it's this idea of smarter regulation, that rather than telling retailers that you can't have a chocolate bar within a certain area of your checkout, telling them not to put volume promotions on HFSS products, actually saying to retailers, you have to meet this target. It's up to you how you achieve it in your stores.
This is quite worrying stuff for a free market where they're wanting to be imposing thresholds and targets on the
Mm-hmm.
actual market itself. And do we have any information about what this mandatory data collection may be, or who it may be from within the food sector?
I think it is clear that it's going to build on existing voluntary reporting by big retailers. But there have been different ideas coming out of various different sources about whether it should be just big retailers, potentially only those designated under GSCOP, versus all retailers versus also out of home, and also different ideas about whether it replaces the marketing restrictions or whether it's in addition to the marketing restrictions.
And by the marketing restrictions, that's the sort of the volume and the placement restrictions of your sort of bog off deals and your
Yeah,
by the
I
till.
mean, well, I mean, I was actually talking just about the volume restrictions, but I mean, some people would say let's do away with the whole lot. They are, of course, the same bit of legislation, so we could potentially replace both of them with these targets. But I think what is clear is that in the short term, the targets are going to remain in law. And we are probably at least a year or two away from this actually crystallizing into some kind of package of definite measures.
I would imagine that whenever there is the consultation on how and what this data is, what the metric that might support any health standard in the future is going to be pretty crucial for the entirety of the food sector to respond.
Yeah.
Because these parameters, as we've seen, once they're set, it's so difficult. We've got the nutrient profile model for 20 years. And so it's going to be really crucial for whatever the consultation on the data will be. So if there's any questions, it's such a massively broad topic, I'm aware, and we can keep talking about it, but also wanting to have you have the chance to approach with some questions here. We have a question from Lynn Hill on the views on using content on organic social channels that include paid for influencers in the assets. So this is looking at the sort of the influencers on social media and the views on using organic social channels.
Well, the legislation, so we're talking about the advertising restrictions here, talks about restrictions on paid for online content. And the restriction is on actually paying, if you like. So the question is going to arise here, are you as a business, this particular food business, paying for that advertising, which might take the form of paying for space on an online platform, or it could take the form of paying for an influencer. So if you have paid an influencer to produce content, even if that payment is in the form of product, for example, which it quite often is, or a free experience, then that would definitely be caught by the ban. If you're more talking about taking content that is created by influencers themselves or otherwise organically created and then reposting it on your own organic channels, that provided you have not actually made a payment to that influencer is probably okay under these restrictions. But you do need to be very mindful whenever you do anything in this space that all the HFSS legislation has been iterative. So these new restrictions do not sweep away any of the previous restrictions that you talked about earlier. So you would still need to consider whether that's appropriately targeted and whether it is, making use of celebrities popular with children, et cetera, under the existing rules.
Yeah, that's it's going to be so fascinating because there are already so many ASA rulings on where you've forgotten to put hashtag ad or someone's had some connection, and this is just expanding it all out. What would there's another question here that's just come up. Oliver Dean, for the advertising restrictions, the outlined 13 categories includes a lot of products, but also misses many others, for example, pestos or ingredients like vanilla extracts, which aren't talked at all. Does this mean if a product is not specifically referenced or under a category, it does not fall in scope of the restrictions?
It's an interesting question. So the new generation, so the original HFSS legislation simply asked you a one limb test. They asked you to run the HFSS profile and establish whether your product was categorized as HFSS or not. And if the answer was yes, then the rules applied. If the answer was no, they did not. And that regime still exists. The next generation, which is these advertising restrictions, the marketing and the location restrictions, are a two limb test. So it's HFSS and in the categories. So it's sort of like a little flow diagram. If your product is HFSS but not in the categories, then the old restrictions apply, but the new restrictions don't. So you would end up in an advertising sphere where you wouldn't be caught by the ban on paid online or the TV restrictions, but you would still need to make sure they're appropriately targeted and not using devices popular with children, et cetera, under the old regime. My only watch out there is that the categories are not drafted in a particularly easy way, but they have if you like, they have a name and then they have a non-exhaustive list of examples. So I would be cautious of saying that just because your particular product is not on the non-exhaustive list does not mean it's not caught, because you need to think about whether it would be caught, if you like, by the name of that category. But you are right to say that generally speaking, that things that are more like ingredients tend not to be on those lists, because the point of the categories is they're meant to be categories that are particular factors in childhood obesity, which goes back to the strategy that Rhian's been talking about behind all of this.
And you see also this is the catch-all for the ultra-processed foods where the categories tended to be those that mostly were responsible for the childhood obesity rather than the baking ingredients. It is interesting how you do see the activist groups looking to expand these categories further, perhaps outside of childhood obesities. And this is an area where the food sector is going to be looking at. I think the division points between the categories and what might or might not be excluded is going to be fascinating.
And hotly contested in the enforcement. Because I think this is the other thing. The legal ban is going to be coming in the beginning of the year. So probably starting from about Easter next year, we will start to see decisions by regulators about how they apply all of this. And I think there will be decisions on those kind of borderlines on the categories, on what amounts to paid, how we're going to apply the brand exemption. So sort of the second half of next year, we're going to learn a lot about how the regulator applies all of this. It's also going to be a very high risk enforcement environment.
Absolutely. And the last question, I'm afraid that I'm going to keep to you, Katrina, because it's such a specialist topic here. It's a really lovely last question, though, to end off our session this morning from Amelia Warburton. How does all this pave the way for healthier, so a sort of positive look at this, for a healthier alternative food and drinks brand to take over the market with substantial growth?
I mean, that is, of course, another part of the policy. We all have to eat food. The idea is we should all eat less food, which is high in fat, salt, and sugar, and are in categories that drive obesity. And rather, by creating these restrictions, for example, that those brands can't be on gondola end, that creates space for healthier brands to be in those prominent bits of store or to be at the impulse section at checkout, but also to grab some of that advertising space that you need to build brands. So,
and one of the other options might as well be the reformulation. If you're in an HFSS sector, can you reformulate? Is this going to be a move towards some more sweeteners in product, or is it going to be a move towards more the sort of the wellness aspect, or an individual ingredient that you can put in there to make your product more interesting? If where can you position your product or get a new product on the market? But I think we'll probably have quite a few more questions, but I'm going to have to end our brief coffee briefing there. But please do leave feedback, and there will be a recording available. I'm sure there's going to be additional questions, in which case to get in touch with myself, Jessica Burt, or Katrina Anderson or Rhian Vandrill, and we'll be happy to follow up with you afterwards. But in the meantime, thank you so much for joining us, and please look out for our next session that we'll advertise shortly. Thank you.
Thank you. Bye-bye.